people that move here are hardy people. So we know how to take care of ourselves, but also we're hyper aware of like each other and who is in need, because we rely on each other. Watching the healthcare situation out here, understanding how hard it is for doctors to be here, how hard it is for this model that we had with the hospitals. It's just difficult, and health is important. Health is important to the community. Telemedicine was just, like you just heard a little bit about it 6 years ago. And I just felt like that was the way that we had to go somehow. So I started knocking on Texas Tech doors, and someone gave me Tim Benton's name.
One day I was sitting at my desk and the phone rang, and it was Marcy Roberts. And Marcy Roberts, being a leader in the community in Marathon, was looking at how do we get healthcare in a small community. We began exploring and brainstorming ideas of how to deliver care. And they had a history in Marathon. It was small enough that they couldn't keep a provider, in person. So we began exploring the opportunity of telemedicine. They had a facility, but they just couldn't put a person in there all the time. So we thought, well, let's put a virtual person in, put a virtual doctor through telemedicine. I think Marathon is an example of why we need telemedicine and telehealth delivery throughout the region, certainly in West Texas.
I had a thing called a TIA, a transient ischemic attack. It's like a mini stroke. And we went to the hospital up in Alpine, which was 30 miles away, and they did a diagnosis on it up there, but didn't transport me. And so I had to make an appointment with an MD, which took me a month to get that appointment. Looking back on it now, if I'd have had something where I could have come in that very next day and gotten hold of somebody to analyze what had happened, I'd have been a whole month ahead as far as treatment plan goes.
For the first 14 years we were here, I really worried about our health care because there was nothing close by. Doctors come and go at Big Bend, and I really worried about that.
There's still people out here, and we still need good doctors, and we need a system for the health, and especially for the elderly.
A good system.
A good system.
Yeah. I myself had a telemed experience with an oncologist in Odessa, and so I get my tests done. But then I have to go to Odessa just to meet with her to discuss the results, where telemed has been a real good instrument to avoid that 3-hour trip or 6-hour trip
and the gas money.
And the gas money.
And that's the difference here. We're talking about a completely different model in a health center. You have access to the kind of help immediately. That you don't have to wait 2 weeks for a doctor's appointment. If you wanted a doctor's appointment, we could probably get you one tomorrow. And the other thing that does is that it allows you to have a doctor's appointment Monday through Friday, 8 to 5. All of that actually is giving us better access to care than what we had before.
I think that telemedicine offers the ability to provide sustainable health care and sustainable communities that we wouldn't otherwise have in some of these small, remote areas. Marathon is a great example, and really to me has always been a pilot experience. If we can perfect this in this community, then why not multiply it and expand it throughout multiple communities in the region, even throughout Texas.